Hello, I'm Dr. Ed Laskowski, co-director of Mayo Clinic's Sports Medicine Center, and you're watching Mayo Clinic's Facebook Live. Today, we'll be discussing what every runner needs to know, coping with and preventing running injuries. We want to hear from you, so please post your questions related to running injuries in the comments below. Joining me today is Lin Gentling. Lin, thanks for joining me today.
My pleasure.
Lin and I have known each other for years. Lin is an elite athlete herself, done tons of marathons and running events, and she is actually coach of USA Ultramarathon. Lin, tell us some other facts about yourself.
Thanks, Dr. Laskowski. It's a pleasure being here today. I've been a competitive athlete since age 8, but in the realm of swimming, and I turned to running at age, well, I won't tell you my age because it's older than many of you are already in existence, but I have been running for over 40 years, and during that time I've had the great privilege of working with beginning marathoners in a marathon training class, and we've been doing that for about 25 years now, well over 1,200 alums, which has been a great source of pleasure for me, as has been running on the national team for 2 years and then coaching since 1993.
That is great, Lin. And Lin is an incredible elite level coach, but what gives me pleasure to see how she works with first timers and people who have never ever run in marathon training classes and gets them to accomplish their goals. So thanks for being here.
My pleasure again. Thank you. What I'd like to start off with today is something that is relatively new to running, and a lot of people don't even consider it in their running programs, but it's core strength. How does core strength contribute to an all-round runner, especially a runner who's training to run 10 miles, half marathon, or full marathon?
That's a great question, Lin. Core strength, we think of core, and I'll just kind of stand up here to show you. Sometimes we think of core as being just the abdominal muscles, and that they only work in one direction and one plane. So when you think of sit-ups, they train this motion over and over. What core really is all the muscles from here all the way up and all the way around circumferentially. So that core is the foundation from which we propel force when we run. So it's very important for a runner. And it's maybe not want to think, well, I run long distances, I'm good. But that core is very important to train. And we have a couple of examples here of the training that we think is optimal for this. The first, I'm sure everybody has probably heard of, is a plank. And we'll show a slide of this. So the key thing to remember in a plank activity, plank exercise, is keeping that body level. So if you see on this slide here, going from her shoulder to her ankle, you could draw a straight line. We don't want the hips to be sagging downward. We also don't want the person to have to keep hiking their hips upward, and that indicates they're not controlling the core as well. If you can hold this position for about 60 to 90 seconds, some of you can do it more, and that's great, but if you can do it for about 90 seconds, that means you have good control of the core, and those muscles are working together to stabilize that section. We have another graphic here coming up. In similar ways, you can also try, this is a reverse plank. So again, you can see in this example, she's got a very straight line. If we drew a line from her shoulder to her ankle, very straight, we don't want to see her sagging downward or having to keep hiking upward. That means she's kind of losing control of the core. So these are two good practical ways that you can assess your core and how it's working. So if you can do those for about 90 seconds, that's a good thing. We like, in core training, again, we like to train the whole core system. So oftentimes we'll not do as much of the sit-up type exercise. We'll do more coordinated exercises. So these tests can also be used as strength exercises, the plank, the reverse plank. We also like to challenge the core in a standing position. And many of you have probably seen a lot of fitness ball exercises with core and all, and that's great, but we don't run in a horizontal position. We run against gravity. So we like to do things that work against gravity. So even a standing exercise, say a single leg biceps curl standing on one leg, that trains the core because it's training the core to work as a stabilizer while other muscles do their work. So a lot of different ways to train core. We do have, if you go on mayoclinic.org and look at, it's called the Core Strengthening slideshow. We have a whole slideshow of core exercises which you could look at. They're picture described and word described, so we kind of tell you what to do, how to do it, and give you a good cadre of exercises that you can pursue there.
I've noticed oftentimes as the marathon will progress, a runner's posture might change, and they are starting to lean over. Is that due to a weak core system?
You know, it could be. It could be. The core, again, is that foundation. So all the force that we're applying when we run has to come from a stable platform. So if there's a weak core, we see many of our runners experience back pain. They can experience postural issues, postural alignment problems. So it feeds into a lot of, it's really a big linkage between our upper and lower bodies. And we think sometimes the upper bodies are important, and they kind of are. They help with force generation. And as we're moving our arms when we're running, we're actually helping with forward momentum. We're actually helping with balance. So those are important things too.
Thank you, Dr. Laskowski. I think we'll go on to the next topic, and that is iliotibial band syndrome. And I know that this can be the bane of many runners. Runners may have a 4-month program, and about 2 months into their program, all of a sudden things go south relative to their knees or their hip area. Can you tell us a little bit about that syndrome, and maybe what a runner can do to prevent it, or if it should come on, what they can do to deal with it?
That's a great question, Lynn. We often see iliotibial band problems, and they usually occur when a runner is advancing their mileage. So they may be running about 2 to 3 miles, just doing fine, and then they try and do a half marathon, or they're training for a full marathon, and that as they get into that more elite level mileage, 7, 8, 9 miles, they get pain on the outside aspect of the knee. And that's where the iliotibial band is located. The iliotibial band, as its name implies, goes from the ilium in the hip, and it goes all the way down into the tibia, one of the big lower leg bone. And right as it crosses over the knee, there's a bony bump on the knee there that can cause that band to get friction and to get irritated. So it's a very common thing that we see in our runners, and a bane of many runners, because you may think, oh, well, it's not a major injury or anything, but boy, that pain really inhibits you from advancing your running mileage, and it also can change your technique. It can make your mechanics altered because you're trying to protect that knee. So very interesting. We think of iliotibial band as being in the knee because a lot of times that's where it's appreciated. But actually it starts, we find, up in the hip. And we have a graphic to represent that. This is actually a person doing a single leg squat. And this is one of the tests that we do to identify if somebody may have iliotibial band, factors that predispose to iliotibial band pain. So this person is doing a single leg squat, and as you see here, her knee is diving inward. We call that dynamic medial knee valgus. And actually one of the researchers here at Mayo Clinic, Dr. Tim Hewitt, identified this as a very important factor in a lot of lower extremity conditions. In fact, this plays into actually ACL injuries. Many of you may have heard of the epidemic of anterior cruciate ligament injuries that are occurring, especially in girls. This has been found to be a specific factor when you're doing a single leg squat, when that knee dives inward, that's a predisposing factor to ACL injury, as well as a bunch of knee conditions and a bunch of hip conditions. And this is something that we see in our research now as a factor we try and correct. So we'll kind of have a next graphic here that shows us actually some of the ways in which you can have a problem with this. And see that knee going inward, and this is just the hip conditions related to it, but when that knee goes inward, it tugs on some of the tissues located, and you see that bone in the hip there, they can rub over that bone in the hip, so you can get pain in the upper part near the outside of the hip. It even can contribute, you see the low abdomen there where that crosshairs are, they can even contribute to a sportsman's hernia and put abdominal strain on. It's going to roll that knee inward, so now you're going to predispose to some knee injuries like what we call patellofemoral pain. And patellofemoral pain also is very common in our runners. The patella is the kneecap, and it tracks in a groove. And when the knee goes like this, in the inward position, it causes a little bit of maltracking of that kneecap in the groove. And that causes some friction, irritation, and we call that patellofemoral pain. That also is very common in our runners. And just think, this is a static position. If somebody's doing this in a single leg squat, just think if somebody's running and doing hundreds, if not thousands of foot strikes, the force and on these tissues that is going to be promoted from this movement pattern, that's not really the best. When we run, it's about 3 to 7 times body weight on our joints when we run. So that can be magnified, and You can see all the things that they can contribute to, from the snapping hip to the iliotibial band, both at the knee and at the hip, to trochanteric bursitis. That's a burst as a fluid-filled sac about the hip. All these things can play into it. So fixing this gives us a very high yield in protecting people from iliotibial band problems and also from knee problems like patellofemoral pain. We're going to have another graphic up here that shows us some of the ways in which we can look at this. This is actually a video of, or a slide of a video analysis of our runners. And we do use video analysis a lot. We have a two-dimensional setup where we video you from the side and then we video you from behind. And that gives us a lot of information. When you come to see us in the office, we have what's called a static review that we can do. We have you stand and do some things. But really when you run, we can identify some things that really contribute in a different way. And when you dynamically move, things change and things that happen that we can see that may feed into how you're feeling. And also to overuse injury. And we see this runner here, you can see that her hip, where it says that 7.5 degrees, her hip is actually a little bit weak as we're looking at her on the left side. And because of that left side weakness, she's actually dropping the pelvis downward a little bit. Now, as you can see, that can lead to some issues. Her knees are basically touching each other there and rubbing together. So she has almost that dynamic medial knee valgus when she's on single leg stand there in this picture, contributing. And you can imagine that can predispose her ITB. It can predispose her lateral hip muscles and her bursa to overuse and strain. So those are some of the examples that looking at a video analysis of movement can give us. So we find video analysis to be very helpful. And a trained professional, it certainly can be done in a running store, but it's really nice to have a physical therapist who's adept at really identifying running injuries to really take you through the running analysis. And we can actually point out there may be a specific inflexibility, a specific muscle imbalance or muscle weakness that you have, and we can uniquely address that to you and give you the tools that you need to correct it. And the correction may not be what we think all the time. So our next graphic here will show a slide, and it will show us that the strengthening of the hip abductors, we think of sometimes those machines, where we sit down and we kind of push the hips out or pull them in. Those are strengthening for the hip abductors. The abductors are ones that kind of push the leg out, and the adductors pull the leg in. So we think, oh, those machines will be good, or oh, we'll get a cable or something like that and we'll strengthen the abductors. But that's not really the way we use them when we run or in life. So this is an example of a person starting out. We've actually wrapped tubing, resistance tubing, around their ankles. And we actually do this, we call them monster walks, where you walk like Frankenstein. With that tubing, you'll put one foot ahead of the other. And all the time while you're doing that, that tubing is placing a resistance on the leg and on those hip muscles, believe it or not. So we have a coach look at the mechanics of the knee during this move, and we make sure that the knee doesn't dive in. We make sure that the leg alignment is good. And if they can do this, and this is a front position, we actually have them do a side walk also using this same tubing. They'll learn and they'll teach their muscles to control the hip better. So they'll make the hip more stable, they'll prevent the knee from rolling in, they'll strengthen the hip abductor muscles in what we call a functional position. This is the way we use them when we stand, when we walk, when we run. So this is called functional hip abductor strengthening.
As is the case with many exercises and potential injuries, it's best to use these exercises prior to the onset of the injury. Is that correct?
It's a great point, Lynn. Yeah, we really we have a saying that's kind of corny that we say to the kids who come in. We say, you shouldn't play your sport to be in shape. You should be in shape to play your sport. And running is one of those ones you think, well, I just run. I'm just going to run, and that's all I need to work on. But there are specific interventions that we can make, and like you saw with that, if we see that dynamic medial knee valgus, if you have a trained professional that looks at you, we can set you up for the best success when you run. So taking some time beforehand, getting these issues addressed, looking at you as a unique runner, what your flexibility is, what your strength is, things like that, what your technique is. That's very important, and we can kind of set you up then with a personalized program that you can carry into the future.
Is there any danger in running through ITB?
Well, I mean, it's again, it's not as serious. It's not like a bone fracture or anything like that. But pain causes bad things to happen sometimes, and one of those is compensation. So you may be even running with your friend, you have this nagging injury, and your friend says, well, why are you limping? And you say, oh, I am. You know, you kind of even forget about it, that you're even doing that. But we don't want you to be compensating. So if that pain is significant enough that it causes you to alter your gait mechanics or alter your stride pattern, then all of a sudden we say, oh man, I'm getting some back pain, you know, and it started not from the back, but it started because of the altered gait from the knee pain. So, you know, if it's a low-level pain, 1 to 2 out of 10, doesn't interfere with your mechanics, goes away pretty quick after you run, that's probably okay as you ramp up. But pain is a feedback. You know, it's a warning signal saying something's not quite right. So we want to pay attention to that so we can hopefully fix it.
So in a post-run, if you had that pain on a level of 1 to 2, ice following your run would be the best thing to deal with that discomfort and potential elimination?
Right. Ice is a great modality, and ice reduces swelling, it reduces pain, and all these tissue irritation problems do cause some swelling, and you may not see macro swelling or the joint swelling, but the tissue gets swollen. So the ice is a very good modality for reducing that swelling, for reducing pain. And again, that's a sign, though. You know, it's a sign, well, hey, you know, if it's a normal soreness, normal muscle ache, okay, and ice may be all you need, and just a little bit of Tylenol once in a while. But really, you know, you want to find out what's feeding into that.
Sure.
And what can I do to correct that?
Sure. Good point. Well, that's a injury area that affects a lot of runners, and so I appreciate you spending some time discussing that. Another thing that I'm concerned about is running technique. Oftentimes people say, well, I know who that person is from a distance away because they have such a weird running gait or weird running technique. How does running technique influence our overuse or overload injuries to our legs?
Well, that's a great question, and you know, because again, people think of running. I just run. You know, they don't really think of the way they run or the factors that could play into it. And even in the medical field, before we said, well, that's the way you're made, or that's the way you're built. You know, that's just you. But technique can be worked on and can be changed. And our runners may have heard of a couple of terms: a rear foot striker. That means that when you run, you hit with the back of your foot on the ground first. And sometimes if you're in rear foot striking isn't always bad, but somebody who has had a lot of problems with lower extremity overload injuries, and if they've been, say, getting that patellofemoral pain, stress fractures, things like that, stress reactions, that mechanic of rear foot striking causes a lot of shear force on the lower leg. So there's another gait technique called a midfoot striker, and that's where somebody will go and they'll land with their foot mostly on the middle of the foot before they come up again. So as opposed to kind of landing on the rear and then rolling off, they'll kind of come down more on the midfoot. And we found that technique-wise, increasing cadence, and that's the kind of the footsteps that you hear, kind of just increasing those footsteps a little bit, as much as 10% even, can make you from a rear foot striker to a midfoot striker. So in essence, that'll be the person that maybe has been, Doc, I have a ton of stress injuries. They just keep coming. There's nothing I did what you said, and I did all these exercises, and I'm still getting them. They may just, the way they're made, their mechanics, their alignment may be more predisposing to those injuries if they're a rear foot striker. So a simple thing like cadence will have them increase their cadence a little bit, and that actually makes them more of a midfoot striker. And that midfoot position will distribute the load throughout the leg a little bit more evenly. The rear foot striker, they've got the leg out there, the whole body weight, there's a lot of shear force, a lot of forces acting on the leg when you run it with that mechanic. Now again, a lot of people can run with that mechanic quite well, and as they're wired up in other ways, it's not necessarily a reason to have everybody be a midfoot striker. But if you're having a lot of lower extremity overload injuries, a simple thing like cadence in your technique, increasing the cadence, can actually make you more of a midfoot striker and balance that load a little bit better. Again, that's the advantage of the video analysis. If we do that, we can look at the person in their running mode, so we can see how they're hitting, what foot pattern they're getting, what foot strike pattern. It really helps us a lot there.
Good point. Interestingly, this spring I was involved in a cadence study at Mayo Clinic, and I tried to increase my cadence over the course of 6 weeks. And found that not only did my running technique improve, but also my speed improved as well.
Interesting. That's great.
Well taken. Point well taken. As a runner, I don't think any of us are immune to muscle pain or soreness, especially as we ramp up our training program respective to the events we're training for. How does this occur when runners advance their training program? And what signs should a runner look for? And then when should a runner seek medical evaluation?
That's a great question. You know, all of us, as we ramp up that activity level, so we're training for a half or we're training for a full marathon, we're going into distances that we've really never been in before. So what you're going to experience some soreness, and that's natural. And our muscles, as we go to those more elite levels, make products that irritate the tissue a little bit, and we'll get a little bit sore. When soreness is important is when it causes, again, like we were talking about with the ITB, a change in what you do. So if it's changing your gait mechanics, your pattern, it's caused you to limp. Soreness associated with swelling is probably something to get checked out, especially swelling of a joint. You probably shouldn't do that. So, you know, looking at that, having a trained professional look at that is a good thing. And really, if it's not going away, all of us have that soreness that, you know, after we've done something different, if it, you know, and you may feel a little stiff in the morning, but then, you know what, as you walk around, it gets better, you move around okay, you're doing all right, that's okay. If that soreness persists, if it worsens, it interferes with your daily activity, that's saying, oh, that's a little bit too much. I better get this checked out. We don't like people to be taking medicine prophylactically, and especially the anti-inflammatory medicines. They can actually be quite toxic to the stomach and the kidneys. And when we're running, we get into what we call a volume depleted state, meaning our water content gets down. So it potentiates those bad effects of some of that those medicines can have. Again, not everybody will have them, but we don't really want somebody to take anti-inflammatories before they run. Again, pain is that feedback, and it's what do I need to do? Do I need to change my conditioning? Is there something I need to work on myself? And kind of look at that broader question there. Okay. And I see we have a question from a viewer relating to some injury there. It says, I used to be a runner, but recently have had a bunionectomy. Any advice on how to start running again? Okay, well, first of all, it's a good question. Bunionectomies, we'd have to make sure that your physician who did the procedure was comfortable with you running again. So that's the first line. It's been long enough that there's been healing established. And another is there any persistent pain that you have in that region? Sometimes orthotics, not everybody benefits from orthotics, but somebody who's had a procedure, sometimes orthotics can help offload the pressure at some of the what we call metatarsal heads, and those are the toe bones. So you may benefit from an orthotic. It may benefit for you to have a running evaluation, to really have us get you on a treadmill and look at the way you run, the way your foot is hitting the ground, so we can optimize your technique and minimize the forces that toe will appreciate. We want as much good range of motion about the joint as possible, and again, that's why healing needs to be there. We want that joint to be very flexible and mobile. So all those things will factor, but it's nice for you to see somebody like a physical therapist or a physician really familiar with running injuries and running technique, and they can give you expert guidance on exactly what you may need to work on.
Good question. Over the course of years, things have changed. When I first started running a long time ago, it was all about running. Run as far as you can, as fast as you can, for as long as you can. There were days when we did 2-a-day workouts. Our mileage, weekly mileage, it was not uncommon for it to be 110 miles a week, or a week. But things have changed significantly. Something called cross-training has come into our vocabulary. Help me understand what cross-training is and how it can benefit a long-distance runner.
That's a great point, Lynn. Well, remember we said those forces, 3 to 7 times your body weight through your joints when you run. So that's a significant amount of force. So we find in our research the number of consecutive days you run and the volume of how much you run directly correlates with overload injuries. It's almost like a linear graph that goes straight up. So if you run 3 days a week, your injury risk may be this much, 5 days a week this much, 7 days a week this much. So, and that's just purely the nature of the beast. No matter how much you train or how much you do, more is not necessarily better. So your body needs recovery time. And when we do something like a big run, especially when we're training for marathons or longer distance events, we need to give our body time to recover and incorporate what we do to it. So cross-training is just doing something different that still does a lot of benefit for our aerobic capacity, but protects our tissue from impact load. So this could be stationary bicycling or regular bicycling. It could be an elliptical trainer. It could be like a cross-country ski machine. It could be water exercise. And one of the things that our runners do a lot is water running, where you get what they call a wet vest. It's a buoyancy vest that you put on and enables you to be in the deep end where your feet don't touch the ground of the pool, the bottom of the pool, but it lets you run. It lets you actually do the running mechanics. So you're basically running without any impact load at all and through the resistance of the water. So it's a very effective training tool. In fact, our marathon teams, USA Marathon, use that as a cross-training tool. It's very running specific, meaning it uses the same muscles we use during running, but there's no impact load on the tissue. So it's very preserving to the joint, preserving to the muscle. So it's nice to have something in your repertoire that you like to do that's not running to keep you fresh when you run. So if you run on Monday, you bike on Tuesday. If you run on Wednesday, elliptical Thursday. Run on Friday, swim Saturday. Those are very nice patterns to get into because they really help preserve you, and it keeps you doing what you want to do, which is running, but it minimizes the risk of overload injury. So and especially if you have an injury, that's definitely something we'll have you do. It's called relative rest. We want to rest the part that's injured, the body part that's injured, but we want to keep everything else going. So a lot of times if you have a stress fracture, we can have you in the water and we can have you do some of that water running because we're really not concerned about loading force in the stress fracture. But you're still kind of getting the movement patterns similar to running down. You're improving and maintaining your aerobic capacity. And you'd be surprised, even if you're out of running itself, but doing some other kind of aerobic activity, even after 3-4 weeks or so, your aerobic capacity will be very, very much up there.
Oftentimes I hear from runners who experience injuries midstream in the training program. What now? My marathon is in jeopardy. I may not be able to run it because it's at an inopportune time to experience an injury. If an athlete experiences an injury, does a fair amount of cross training, is it likely that, assuming the injury isn't severe, they can get back into the program again and their objective of that marathon may be realized?
In many cases, that's true, Lynn. Yeah, and especially if you catch it early. I think one of the things that we all tend to do is, kind of ignore this. I mean, it'll get better by itself. And during that time period, it's getting worse and worse. Finally, to get we get to the point where we say, wow, I can't run anymore. So then it's harder, because then that tissue's been irritated or loaded more. But you're right. If we can kind of catch things early, get you cross training, our goal is to keep you out there, keep you running. So the more we can kind of address things early before they get worse, as far as tissue load and stress, the more we can incorporate changes that will benefit you, decrease the loading force, help your tissue strength. That really keeps you out there the best and minimizes the risk that you're going to miss your event.
So in most cases, you can continue with your core strength exercises and many other exercises potentially, as long as it doesn't exacerbate the area of the injury.
Absolutely.
Yes.
Absolutely.
And can you strengthen do core strengthening exercises on the same days that you do a long run or a more intense run?
You can. It trains the muscle in a different way. That's a great point, though, about, again, that recovery that we need. So strength training, you should always keep at least a day in between working the same muscle group. So if you're working your biceps muscles on Monday, you don't want to work them again on Tuesday. You want to wait at least till Wednesday before you challenge biceps again. So if you're doing, say, lower extremity strengthening, which, again, is important. We think of, man, I run. I run half marathons. My legs are strong. But strength training specifically gives us unique benefits. It actually challenges the muscle in a different way. It gets it used to accepting load and force in a different way. So it's nice to do those strength training exercises. So those are things that if we incorporate them, they will hopefully keep us out of trouble and protect us.
Right. Over time, and I've been in running for a long period of time, I can remember being in running when you drank as much as you could because you wanted to stave off dehydration. But things have changed over time, and for the better, of course. What sort of things have changed in your experience over time that runners need to be aware of and they need to incorporate more into their thinking process and their lifestyles?
Oh, it's a great question, Lynn. I think nutrition for running in general is just a whole area that's really taken on its own science, in essence, of how to eat. Before carbo load, but it's more than just carbo loading, right? It's eating clean, eating good food products. Certainly carbohydrate dominant and stocking up and tanking those stores for events. but actually, eating a clean diet all the time, because it's not just race preparation, it's what we do all the time. And hydration, as you mentioned, very important, wasn't looked at that much. Oh yeah, I know I got to drink. But now we have sports drinks that replenish, especially with our longer distance events. We need not only water, but we also need some carbohydrates and some other electrolytes. So now our technology and science of hydration repletion has become more developed. So we're better at advising people there too. One thing that we see is hyponatremia. We always worry about the runner who gets dehydrated. And in the long distance race, especially if it's hot, you can really lose your water. Actually, you can get a heat stroke. So we're really worried about those runners. That's why in the course, especially on hot days, you see people pushing people to take the water, that there's black flag conditions sometimes or yellow flag that will warn people about their hydration. But for some of our runners too, if they're out there in the course a long time and drinking a lot, they can actually get hyponatremia, which is a low sodium content, which can be just as dangerous as the dehydration type picture. So you want that right mixture in there, and in the marathon training course, it's important to know about the nutrition and the hydration for performance that you need. So we have specific, again, we have nutrition and performance on our website on mayoclinic.org too, that you can look at to peruse for different running events, different athletic events. So.
You mentioned briefly about hyperthermia. Can we get hyperthermia when it's cold out?
Well, that's a great question. We actually had a running event last year, which it was 55 degrees, and which we all in the medical tent, we thought, well, at least we won't see any heat injuries today.
Yes.
And sure enough, we had somebody who was not maybe as conditioned as they could be for the race, and really trying hard, and they went into heat stroke at the end of this half marathon. So we had to address that. Fortunately, this person did great. But yeah, it's not just the temperature. It's what you come in with your conditioning, what you come into with your baseline level abilities and everything. So all those things are factored in. So
Good. If there was any advice that you could give a runner that's just beginning or is aiming at their first or second marathon, to keep them out of the medical tent at the finish line, what would you suggest?
It's a great question, Lynn. I think knowledge is power, and the more you know these things, we just talked about, getting with a mentor like you have been a mentor to so many, because your class details hydration, it details nutrition, it details technique, it details injury prevention, all those types of things. So really make sure you look at those things when you're progressing your program. Make sure you incorporate recovery time. Jeff Galloway's a great one, walk, run. It's a wonderful technique that keeps us fresh right in the run cycle itself. Read as much as you can about the topic, because knowledge really does help. So I think we're running out of time here. I think that's all the time we have today. Thanks for joining me, Lynn, for just such a great discussion. If we didn't answer your questions during this time, we'll try to do so within the next few days. So this video will be available later today on Mayo Clinic's YouTube channel, and you can view it then too. So thank you, and have a great day.